Hello, everyone, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. You may understand our show is dedicated to helping you prevent as well as treat all sorts of medical problems safely and naturally. Safely is a very important word, safely and naturally. Today's show is all about inflammaging, okay? It's a combination of the term inflammation and aging. Actually, and I'm going to get right into the show. Actually, this was a term that actually developed, I think, was around the year 2000, um, defined as a chronic low-grade inflammation throughout the body that occurs with aging. But your daily habits play a big part in this important equation. Unlike the acute inflammation that happens when you to help you heal or starts as a reaction to an injury, for example, or to fight an infection, inflammaging, and that's not necessarily, the body can overreact to that, and that's where we have to modulate that acute inflammation to a healthy amount. But inflammaging is persistent and it's subtle inflammatory state that leads to age-related diseases, arthritis, heart disease, all sorts of diabetes, all sorts of medical problems. Um, if you head out for a walk in the morning um, and you're watching or you're sitting around watching a favorite television show or a movie that you enjoy, and you decide to munch on some organic nuts, unsalted, raw nuts and things, instead of eating a bag of chips and you go to bed at your normal bedtime, get the sleep that you need, um, uh, rather than just sitting there looking at your cell phone constantly and all your messages and texting. This is a healthy way to reduce this. So healthy lifestyle choices can keep inflammation in check, believe it or not. Whereas if you do the opposite, okay, it's a problem. If you go and you look these things up, it's claimed that up to 35% of American adults have chronic inflammation, accelerating, leading them to a faster death. The key in life is to grow old and be well. It's not about growing old. I worked in 2 nursing homes for 35 years. Not one person in a nursing home ever thought that they would wind up in one. They would have done anything they could, they say, to have avoided it. But when they had the choices to make, they chose poorly, okay? They chose very poorly. And they did things that accelerated their aging and their body's immune systems weakening and breaking down, and they wound up in a nursing home. Something happened, they wind up in a hospital, and instead of healing and being, discharged, they wind up possibly first in an assisted living facility, and then moved upstairs to the nursing facility because they needed the kind of care they needed. All right. It's believed that chronic inflammation, um, by accelerating aging, contributes to more than half of all deaths worldwide. Okay, if you look this up in chat, I mean, Nature Medicine did a study on this, and that's what they came up with. So, what is actually happening? So, first, you're getting an accumulation of damaged, or what we call zombie cells, senescent, dead cells that release inflammatory signals into your body. And this is what this immunosenescence is, what affects your immune system over time. Now, the mitochondria in your cells are little organelles in every cell that take in oxygen and combine it with nutrients to make energy. And cells need energy to stay alive, make another cell, and do their job. Now, how long they live and how well they do these three things depend upon many factors. Are they getting the right nutrients? Are you absorbing them? You may be eating great food and not absorbing anything from your gut whatsoever. So that we're going to address in a little bit on how to fix that aspect of it. In addition, you need enough oxygen. I have a close friend of mine who we started helping. He's been a cigarette smoker most of his life, I think. I think when he was born, they handed him as a baby right after they slapped him a cigarette and a lighter and helped him start. I'm not joking. It's been very bad. And when I check his with an oxyometer, that's a little device you can buy and you can put over your finger. His oxygen level was beeping, beeping, beeping. Why? It was fluctuating with each breath in and out between 88 to 92%. That's not good. You want to be at least 95% or better. And most people, are in the 95, 6, 7, 8, or 9%. Nobody's going to be 100%. I don't believe that's even possible. But in that range is a healthy range. So what's saying? His lungs are damaged and maybe loaded with tars so that he's not absorbing enough oxygen with each breath. We have an answer for that, and we're going to talk about it when we talk about how to deal with all this. Another big, if you look this up, you'll find I don't make anything up. Another big cause of inflammaging is changes in your gut microbiome. You have to have a healthy gut. If you don't have a healthy gut, you're not going to absorb the nutrients you need. Plus, unhealthy microbiome, okay, put toxins into your blood. All right. Whereas a healthy gut produces, and listen to my podcast on it, GLP-1. Ozempic, those drugs that they've been advertising to help you lose weight and control diabetes. Your gut makes it. This is where they got the idea from. So why do people need it? Because their gut isn't making it anymore. Why isn't their gut making it? It's unhealthy. What makes an unhealthy gut? Eating poor food that doesn't help the gut microbiome survive and grow in strength and number. And because you've had antibiotics, even if you don't, even once in your lifetime, kills all the good boys off. And you think you're putting good ones back in, but we're going to get to that when we discuss the gut in greater detail. Yes, this is going to be a two-part show for sure. I hope not to make it a three-part show, but it's definitely going to be a two-part show because there's just so much to talk about. And then yeast overgrows because it's the healthy microbiome, not the unhealthy ones, that can help keep yeast Candida in check in your gut. And if you have yeast overgrowing, just look it up, listen to my show on it, or look it up on the internet, and you'll see all the range of symptoms and medical problems that happen with that. So this is contributing to inflammation in your body, you see, and it's not only contributing to causing greater inflammation, it's not eliminating the inflammation and helping keep it in control. And by the way, back to mitochondria, when they stress, when they're not doing their job, you develop what's called oxidative stress in your body. And oxidative stress has negative impact on your body and causes increased medical problems. And then lastly, but not least, as I mentioned already, lifestyle factors such as a poor diet, basically you're inactive, you don't exercise at all, excess body fat, which most, over half Americans are overweight, not enough sleep. You got to get as much sleep as your body needs. Everybody is different. Everybody's body is different and needs different amounts. I sleep 4.5 to 5 hours a night. I have tremendous energy. I'm 78. When I was younger and in the best shape and condition, playing judo, as I did for so many years, that was my main sport, my main activity. So everything was getting in shape at the gym so I could do judo a few times a week and survive it. I worked out at the oldest judo club in the USA for starting in 1919. It was started, not me, but it. And So it was a pretty well-known and important judo club that's now unfortunately long gone. But I did it for 18 years, and to survive it, you have to be in great shape. Um, and then I only needed 3 to 3.5 hours sleep a night because my body didn't require more. I was tremendously energized from the moment I woke up till I decided to go back to bed again. And stress in general. So, what is stress in general? Getting slapped in the face is stress. Getting kissed is stress. They used to have published, and I bet you can find it on the internet, all the main causes of heart attacks. Um, the top 10, they used to call it. Getting married, getting divorced, selling a house, buying a house. Um, all these things stresses your body. The body doesn't know the difference between good or bad. It's just stress. And you have to deal with stress in an effective way to minimize the negative effects that stress causes. So, just to be clear, inflammation is a normal process in your body. It's a natural protective part of your immune system. So your body can react to short-term injury or infection, and it helps the body heal. But when we get older, our immune system isn't as efficient in controlling this this reaction, and basically, very quietly, this inflammation starts to damage the cells in our body. The people who live the longest in the world have learned through lifestyle how to control all this extra stress. So there are, many centenarians. That means you've lived for 100 years, and I want to be one of those. Some years ago, it was determined that by the year 2050, there'll be over 1 million centenarians here in the USA alone. And I certainly want to be one of those centenarians. I mean, technically, our body cells should be able to live to 120, and some claim 130 years. Okay. So to make it there and to have quality getting there, you have to be doing things that help. So why these people live longer, and I want to be one of them, as I've said, is because their cells don't accumulate all this damage that you can get from poor living habits. And we're going to talk about all the things you can do. So what does this lead to? As I said before, a cardiovascular disease, heart disease, number one killer in the USA still, right? Followed, I think, by cancer. Type 2 diabetes, neurodegenerative diseases like Alzheimer's and Parkinson's and all other forms of dementia, arthritis. You become weak and have muscle loss. And certainly some cancer develops from this as well. Um, Many people break their hip opening up when they're seniors, opening up their refrigerators, believe it or not. One of the What they do is as they try to pull the door open, they can't, so they yank and their body twists like that. And in that twisting, they have such osteoporosis in their femur, it snaps. And so they fall and hit the ground, and they think they fell accidentally and broke their hip. Their hip broke, and that's why they fell. Okay. I actually have a refrigerator where when you push the door in, it has a little thing up on top that pushes the door out for you. So if I were unable to open my door with muscle strength, I can just push it in. And that was developed. It's a German company, Miele, and they developed that because people were breaking hips, and this is hard to open up heavy refrigerator doors. So there are things that you can do that will reduce this problem. Trying to decide, should I go on? Yeah, let's begin with all the things that you can do. And we're going to go in part two into the most effective ways. So you're going to have to listen to this because you don't want to leave any of the things out. First of all, you need regular physical activity. Sitting around lighting a cigarette is not activity. Playing cards is not an activity. You have to go out for walks if you can. If not, swimming, ideal. Biking is the next best to swimming. I like to bike and swim. If you can't swim, you can go walking in a swimming pool. At the gym that I go to, many of the seniors you just see walking up and down the lanes because some of the water waist deep is, up to your chest is resisting, and you're getting a workout if you do it long enough. You need to do cardiovascular exercise at least 3 or 4 times a week. 5 or 6 is better. You want to try to take a day off of heavy duty stuff and at least 30 minutes each time. And you want to push yourself so you can, work it for distance, so you know how long you or for time how long you're walking for. You can try to keep it to 30 minutes so you're not wasting a lot of time, is more important than anything else in the world. And the way to keep it is to try to increase your speed over the course of months of doing whatever exercises that you're doing. Go longer distances. If you're swimming, more laps in the same 30 minutes. In the biking, more distance in the same 30 minutes, the same as walking and things like that. Yeah, pickleball and stuff is good. If you're going to play pickleball, make sure you wear earplugs. People are going deaf from the banging sound that they hear. They don't think it's important, but it's causing deafness. Remember, sports medicine was my big thing for most of my career. So, sleep. You need to know how much sleep you need so that when you go to sleep at night and you wake up in the morning, you feel well rested. You don't have to, oh, I'm exhausted. I don't feel like getting out of bed. You should be able to get out of bed promptly, get up, get your day going if you've had an adequate amount of sleep. If you're not getting enough sleep, that's a problem, but it may be because the quality of sleep is poor. Many people have sleep apnea and they have to, use a CPAP machine or some other device to help with that. Although I help with that too, as we're going to talk about what we do for this whole process with ozone therapy. At least in part two, we're going to get to that. You want to try to maintain a healthy body weight. Most people are overweight. I've got about 10 that I'm working on knocking down. I had a new hip put in last October. This is July now of the following year, and uh, prior to that, for 6 months, waiting and trying to fix it and not being able to, um, and then going through the rehab and everything. It took me a while, and I had gained some pounds, and now I'm getting myself back down to where I want to be ideally. Um, you want to eat a healthy diet and ideally as much organic as possible. I can go on to a whole show just on what is truly organic. But basically, when we say organic vegetables and fruit, you're dealing with fruit where the farms did not use um, herbicides and pesticides. Now, the water that's getting in from rain and everything else could be contaminated. That is true, unless it's grown hydroponically, but I'm more concerned that they didn't add herbicides and pesticides. We know that's a healthier fruit and vegetable to eat. And you want to be eating organic fruits, vegetables, legumes, um, grains, nuts, whole grains and nuts. Maintain a Mediterranean style diet is a good diet to be on. A low carb diet is a good diet to be on. All this is important. Um, I used to be a medical nutritionist. I don't practice that anymore. I can do a zillion shows on, and I probably will do a number of them on various aspects of healthy nutrition. But you can look this up in chat. What is a healthy diet, to reduce stress? And what should you eat? What shouldn't you eat? And it'll Google or chat or one of these AIs will go through the internet and put it through a few times, and you'll see that it'll keep coming up with the same things. And the ones that are the same things each time are the ones that you should be doing. Um, Managing, of course, stop smoking if you are smoking. I don't care what it is that you're smoking. And um, having a little, a glass of wine or two or a small amount of alcohol, I'm not against that, or caffeinated beverages. I know a lot of functional doctors say don't do any of that. If you have an espresso or 1 cup of coffee a day or two, that's probably not that harmful. But if you're having a lot of it, it is. Okay. You shouldn't be drinking alcohol to any kind of excessive use. You should, it's just, you shouldn't do as you wish. I'm nobody's boss. I barely have control over me, let alone anyone else. So I don't really care what anybody does. I have to go to sleep at night, not worrying about others. But this is up to you to do what you want. And then managing stress. Now, since 1976, I've been doing what's called transcendental meditation, aka TM, uh, the Mahesh Yoga, whatever his name was. That's what he had a whole training programs in it. So I've been doing that for years. So exercise, while heavy duty exercise weakens your immune system for up to 10 to 12 to 20 hours afterwards. After you're done exercise, after that time period, your immune system boosts up. Of course, you got to stay well hydrated. Hydration is key, and we're going to talk about that some more. Managing stress by meditation. You can do Tai Chi. Tai Chi is a great stress manager. You can do Tai Chi. Qigong is a form of Tai Chi that you can do. Um, Great in managing stress. Go to museums, look at art. Art is listen to pleasant music, not anything that's loud and noisy, but calm. Classical music. Not all, but quite a bit of classical music, like Mozart. It can be stress reducing. Comedy, jokes, tremendous. I use a lot of jokes in my life when I talk to people and patients and whatnot. And humor boosts your immune system, raises your pain threshold, and reduces stress. Laughing, being happy. You're on this side of the grass. Every day you're on this side of the grass is a wonderful day. I know all our lives are loaded with various issues and whatnot. Everybody has problems that they have to deal with. But as long as you're on this side of the grass, you got another day to deal with them. It's a wonderful thing. As you get older, you learn that. How will you let things bother you? How you let things affect you is very important. Um, I had to develop, maybe this will help some of you, an attitude. Every time something negative would happen, I automatically would say to myself, if I knew I was going to die tomorrow morning at 9 a.m., how much would this matter to me today? How long will I ruminate over it and be upset over it and aggravate myself over whatever it is? And with that, as I learned to call it, as compared to death, how important is this? I was able to reduce my stress levels tremendously. As just a small aside, since the middle of May, which is about 7 weeks ago, I had to replace a dive watch that I've had for years and repaired a number of times that just completely went. I had to replace a brand new snorkel because the new one wasn't working. It was leaking instead of keeping the water out, letting the water in. I had to replace a leaf blower, a power washer. Uh, my home air conditioning system went, and we were having 100-degree weather this past week. I had no air conditioning. Um, Completely gone. Old system needed to be replaced. One of my big shed doors came right off the hinges. How do we had to go fix it. I had to do power washing on the bricks and then repair all the bricks and everything that I had to power wash. Um, which is why I had to go through all that. Um, I know I'm leaving some things out, but I'm just giving you an idea that in about 7 weeks, all these things were happening. Okay. All these things were breaking and going wrong. And I had to deal with it all. That's all. I mean, it was just, how important is it? I'm here. I'm able to go on and do things. Very fortunate. Listen to the show that I just did on Ebola, and you'll understand why we're so fortunate and lucky to be here. Okay. Um, Massage is a wonderful way to reduce all this stress in your body. when I go away, I do massage. Chiropractic is a wonderful thing. I get chiropractic from Dr. Maxine Mayreese in Glen Cove, New York. I get chiropractic from her every week. Um, After 18 years of judo, I would have chronic low back pain. As long as I'm doing chiropractic every week and my exercise and everything, my low back is pretty darn good. I don't suffer from a severe arthritic problem or anything else anymore. These are key and essential. Oh, by the way, when you do go to the gym, I don't care how young or old you are, you need to do some weight training. You need to keep your muscle strength up, and we start to lose muscle strength and mass as we get older. I'm trying to go through my mind on things that I may have left out. So in any case, those are the majority of things that you can do, except what we're going to be talking about now in part two. Okay. So please go to part two. And by the way, please subscribe to my channel. It's free. My techie people say it's important that people subscribe so we get more visibility. Tell your friends about it. If you have any questions about this or any of the things we talked about, call my Manhattan office and they'll be able to help you get in touch with me directly. Yes, I am available and I don't charge. Okay, for those calls. It's 212-581-0101. That's 212-581-0101. And my um, uh, email address, if you have questions, is ozonedoctor@yahoo.com. That's OZONEDOCTOR at yahoo.com. Ozone Doctor, one word, all spelled out, at yahoo.com. Okay, we're going to be talking about the most important ways to help control and reduce inflammation, in addition to everything else that I've already told you. Okay, more powerful ways of reducing it on their own, um, which sometimes can make up for where you're goofing off on some of the things we spoke about today. So make sure you tune in and listen to part two as soon as you possibly can. Everybody, stay healthy, stay well, and thanks for listening.